What's up, you guys? Dr. James Stirrett here. Today we're going to be talking about the top 3 reasons why every guy should be on testosterone therapy, TRT, at some point in their life. Now, this might be a bold claim for some of you guys, but the thing is after seeing thousands of patients over the last 10 years and putting many men on testosterone therapy, I can tell you right now that there is so many benefits to testosterone therapy. And today we're going to go over those top 3 reasons. It is controversial, but we first need to take a look at why it's so controversial. One is the stigma that is actually around testosterone therapy, TRT. And I believe there's actually 2 reasons why society kind of looks down on testosterone replacement and makes guys feel like at the end of the day, like they have to do something icky or step out outside of what is good and secretly seek care. And I just feel like that feeling for a guy to feel like, oh, I have to quietly do something that's maybe not good in order to feel better and hide it from everybody is just a completely stupid way to look at it, but it's because of the way society looks at things. So, number 1, bodybuilding has kind of wrecked the stigma for testosterone therapy. People think of testosterone in terms of it's only for guys that really want to get jacked, their balls are going to shrink, they're going to get roid rage, acne, and that's simply just not true. When testosterone therapy is managed well, literally none of those things happen, and we can manage them effectively, and it tends to help guys feel so much better. So it's really sad to see that both men and women kind of have this negative view of testosterone therapy. The other thing is clinics that are around that just prey on men that know that they need testosterone therapy. These TRT clinics, they're in every city. You'll see their little ads popping up here and there. Basically, they're places where guys can go, get testosterone therapy, and there's going to be a doctor on the other end that doesn't know who they are, doesn't know their story, doesn't care about them. They just want to make the money and slang out testosterone therapy, and that's all they do. They do labs once or twice a year, and otherwise they just send them out the testosterone and collect the checks. This leads to poor management, and it leads to people just feeling like testosterone therapy is a scam. When it's not a scam, when it's done right, and you're not underdosed and you're not overdosed, and someone's actually following and tracking along and making sure that your dosage is appropriate for your body and relative to the rest of your labs, it can be so helpful. So today we're going to go over the top 3 reasons why every guy needs to be on TRT. And remember, it's at some point in their life. So I've tested guys as young as 17 years old, and I've seen low testosterone all up until the ages of even up close up to 90 years old. And I've seen guys with low T at various points along the way. And I just want to back up for a second and say, if you are a male under the age of 30 and you're trying to conceive and you've got low T, testosterone therapy is usually not a very good option. It's going to make that worse for you. However, at some point, especially after 40, and you're not trying to have kids anymore, and your testosterone's super low, it is a viable option that you can stay on long term safely. And so why would you not at least consider it? Those are options. Those are great reasons in themselves. But today I've got 3 huge things that I want to talk about. One is just from a vitality standpoint. Men are going to hit andropause at some point. It's just like menopause in women. In women, around 50 years old, their ovaries stop producing. In men, we don't have ovaries. We have testicles. It's the male equivalent. Our testosterone is just going to be produced in less abundance because our body knows that we really don't need to be fertile anymore, and we don't need to have that total stimulation that we once had. And so with it, we start to see the symptoms arise. We start to see low motivation, low drive, low sex drive, low get up and go, poor sleep, loss of muscle mass. Now, this is around the same time for a dude, 40 to 50 years old, as a midlife crisis a lot of times. This is when guys start to feel less manly about themselves and they got to go do something to prove themselves. They're still got the cojones. They still, they'll go out and buy a fancy sports car or whatever because we feel like we're lacking. It is not selfish to want something more for yourself. If this is the reason why in your life, if lower testosterone is the sole reason or one of the reasons why you are feeling unmotivated and tired, then it sucks to think like that society is going to condemn you for an injection that's going to bring your levels. It's not going to make you Arnold Schwarzenegger, but it's going to bring you back even keel to a point where you were in your 20s and 30s and be able to help your body recover at that same rate. Think about aging, just from an anti-aging standpoint, you guys. There's a few different really serious components to aging, but one of it is just the abundance of hormones going down in the body. And you're losing that anti-inflammatory and protective value, that regenerative value of the testosterone at the cellular level is going to make you not just feel bad, but it's also going to make you age faster. So that's just strictly from like a feeling better standpoint. But number two is let's look at the longevity implications of testosterone therapy. There are many, but I am going to talk about a few different things here that I think are super important. One is we used to say to guys, if you have cardiovascular disease, stay away from testosterone therapy. It can increase your risk of stroke, heart attack, all this stuff. I think that was based off some pretty poor research, but recent meta-analysis shows that we can actually see some reversal of cardiovascular and CVD, basically clogged arteries within the heart, arteriosclerosis and atherosclerosis. We can see some reversal of that with testosterone therapy when it's done right. And it's not done at unsafe amounts. We're just basically restoring what the body once had, right? So it's physiologic, not super physiologic dosing. So it is very possible that testosterone plays a role in the maintenance of our arteries. And I actually would take it even deeper and say that testosterone, it has such an impact on your metabolism and helping balance insulin resistance and reverse insulin resistance. Because I've seen plenty of guys where all we really did was put them on testosterone therapy, and their insulin levels came down and their blood sugar started to stabilize a little bit. So how could that not have a benefit on your cardiovascular system? So the next component of number two here is, and within longevity, is actually the neuroprotection benefits that we see. This is a really interesting study and meta-analysis. In particular, we found that men with Alzheimer's disease all had low testosterone across the board, like almost with no exceptions. Low testosterone is seen in men with Alzheimer's disease just like it is seen in men with arteriosclerosis, and cardiovascular disease. So what has Alzheimer's been called? It's been called a vascular issue, diabetes of the brain. Like, these are all things that are intertwined. What we like to send one to the cardiologist and one to the neurologist, right? We have different doctors that deal with different components here, but we're all the same system. And what if it is our blood sugar and our metabolism and inflammation that is impacting our cardiovascular system and our neurological system that is causing issues, right? So cardiovascular disease in one, Alzheimer's in the other, or neurodegeneration. If a guy has normal testosterone levels, could that help slow the degeneration of Alzheimer's? I don't know. We need to do more research here, but you better believe it. If my dad had Alzheimer's right now, or I had Alzheimer's right now, I hope to God that someone would prescribe him testosterone, because why wouldn't you at that point? You are literally losing your mind. You are losing your life. Why would you not protect yourself with the potential protection of testosterone? And number three may be my personal favorite, and one of the reasons why I believe that patients have really liked working with me over the years. And it really actually has nothing to do with me. It has the fact that I have prescribed testosterone therapy to both men and women again and again and again and again in appropriate scenarios where it is clinically necessary. And these are individuals that came to me that were tired, that were unmotivated, gaining weight, not feeling good, had digestive issues, had a host of other medical problems. We put them on testosterone therapy, maybe balance out some of their other hormonal stuff. And what did that do? It actually gave them the momentum, the drive, the energy to pick themselves up off the floor, get out of the rut, and start making other impactful lifestyle change. Like what? Like, what am I talking about right now? I'm talking about actually working out every day. I'm talking about eating a whole foods diet that's actually good for them and their body. Because let's be honest, if you just came in to see me and you've got a ton of stuff wrong and you feel like crap, and I'm like looking at you and I'm like, okay, you need to exercise every day, and you need to stop eating out, and you need to start cooking and meal prepping, and I did nothing else for you. I'm like, all right, and that's it. I already set you up. I gave you the roadmap. Go ahead and do that. I may have just given you the roadmap, but there's no way, like 99 out of 100 people are just going to be like, all right, well, thanks. I feel like crap. I don't feel motivated to do any of this stuff. And they're going to go on about their way. They're going to go on about their life, and they're going to feel like a failure. This is why the conventional medical system fails people, you guys. So you go in to see your doctor, and they're like, oh, yeah, you have sleep apnea, or you have high blood sugar or blood pressure. You need to lose some weight. So just go ahead and eat better and start being more active. Try keto. I hear that's pretty good for people these days. How is that going to work out, guys? It's not going to work out well at all. So how about a different approach? For me, my approach and my practice is hey, let's take care of the hormones. Men and women. Let's take care of the hormones. Let's take care of the testosterone. Let's get you some freaking motivation, and let's get you back on the map feeling like you've got to win. You got some energy to do something in your life, and away you go making other lifestyle changes. And that is what has worked so well for my clients, and I believe why they continue to come back to me and refer to me. Thank you guys so much for watching. Obviously, this is a topic that I'm very passionate about. If you are a man or woman and you are struggling, please get your hormones checked. If you're in Washington State, you can work with me. If you're somewhere else, find a functional medicine or naturopathic provider that can help you, okay? So if you guys enjoyed this, go ahead and hit the like button, subscribe, hit that little bell notification so it lets you know when my next video is coming out. It should be every Tuesday. But otherwise, guys, I will see you next time. Take care.